All right. Thank you everyone that has joined us this evening. Welcome to tonight's webinar, which is the first in a three-part series titled SiHy One Day, The Time Is Now. I'm Dr. Steve Roszinski, Senior Manager of Professional and Academic Affairs at CooperVision. We will discuss how fellow ODs are making remarkable advances in their practices and patient satisfaction by leaning into SiHy One Day contact lenses. With your patient's needs for health and safety heightened, we talk tonight how SiHy One Day lenses fit with the picture and how to best educate your patients about their benefits. If there was ever a time to make a change, it is now. So I'd like to welcome Dr. Jack McIntyre here today from Doctors McIntyre and Garza from Corpus Christi, Texas. Thank you for joining us tonight, Jack.
Thank you.
Next, we have Dr. Drew Provost of Great Hills Eye Care, located in Austin, Texas.
Thank you, Steve.
And last but not least, we have Dr. Jennifer Stewart of Norwalk Eye Care in Norwalk, Connecticut. So yes, thank you all for joining us here tonight. I'm excited to have this conversation. You guys ready to start the fun?
Absolutely.
Yep. Wonderful, let's do it. So let's kick things off talking tonight specifically about the trend towards health and safety, right? So, I'll direct this question first to you, Jack, since you're top of my screen here. So since the beginning of the COVID-19 pandemic, have you noticed that there's been an increased number of patients who are more concerned about health and safety than ever before?
Absolutely, and I think it is more than ever before. It's front of the mind, it's in the news. I think we're in our 7th month of the pandemic, and we have the CDC protocol, so we're taking the temperatures and doing the rest up front. Plus they need a mask in order to come into the office. And plus, once they're in the office, they have to use sanitizer. We're socially distanced as much as we can. So I think it's very much more than ever, I think, in front of their mind. And so I really do think that, this is a time in our history when people really are thinking about their health more than ever before.
Now, how about, would you say it's specific more to like eyes and maybe even more specifically into contact lenses? Not sure who wants to take that next one here.
I'll take it. So, I think in the beginning there was a little bit of fear and patients were unsure even if they should be wearing contact lenses. If they were, how should I be taking care of them? Should I be doing any extra steps? How should I be managing this? So I think there was a heightened sense of awareness about contact lenses, and there was just a lot of misinformation out there as well. We were getting calls every day, even though our office wasn't closed. We were closed for routine patient care, but we were fielding a lot of questions and concerns from patients about how to wear their lenses and how to do it healthy, how to do it and be safe.
So would you say that the patients have been pretty receptive with it so far, Jen?
Yeah, I think we tried to get out in front of it too when we realized this was something that was on their minds. We tried to be really proactive and communicate that with patients. And while we were closed, we were sending out emails every week to patients, letting them know not only, what we were doing, that our office was open for emergencies and contact lens ordering and other things, but also letting them know that they are able to wear contact lenses and it's absolutely safe to do it. There's some great new ways, there's some great new technology that can help you feel better and feel safer. And, just making sure that we're doing proper hygiene while we're wearing our contacts. But we really tried to get out there in front of it and not have them wonder. We tried to put it out in their minds and make them feel better that, yes, you can wear your contacts. It is completely safe to do so.
Yeah, so it sounds like communication was key there.
Absolutely, and continues to be. That's something we continue to do when patients come in. That's a conversation I have and continue to have even 5 months after being open. Every contact lens patient, I make it a point in the exam room to ask if they have any specific questions related to COVID and their contact lenses, and also just give them, feedback and the assurance that it's absolutely safe to continue wearing their lenses.
Wonderful. No, thank you for sharing that. And I guess I'll go to Drew next to you then. Would you say, where are silicone hydrogel One Days fitting in the picture at your practice?
Well, especially during this time where patients are really focused on their health and being ultra aware of the healthiest option, it's really been great that in our practice we use silicone hydrogel One Days as the healthiest option for our patients, and we've noticed that the ones that were already in that modality had a great deal of comfort during this time, knowing that they didn't have to worry about when they were replacing their lenses and knowing that we've already had that health conversation with them. So I think it's given them an extra level of comfort, and also our patients that are not yet in that modality, we've been able to have that conversation with them as they've been coming in.
So you mentioned the education piece, right, Drew? So, thinking about that, how do you go into that education? How do you actually educate those patients? I mean, if you want to talk maybe just a little bit about what you say in the exam, or what are you doing in particular?
Sure, absolutely. So again, health is coming up as the primary topic during the exam. And so we're definitely always offering the healthiest option to the patients. So whether they're in a 2-week lens, monthly lens, or maybe an older technology 1-day lens, I always start the contact lens evaluation with letting the patient know my goal is to have you in the healthiest, most convenient, and clearest vision option for you. And I believe that silicone hydrogel 1-day lenses, or I'll say ultra oxygen permeable 1-day lenses, are that option. And in fact, I just had somebody today that was in a 2-week lens. They came in, they actually were very happy with their vision and the overall comfort, but their eyes were certainly red. And so I had that same conversation with them, and they ended up in silicone hydrogel 1-day. So that conversation goes along really well with our patients.
Yeah. Any else, Dr. Jen or Dr. Jack? Any other ways in which you maybe do things maybe a little differently, or anything else to add on that topic then?
Yes, I started doing a couple things some years ago. One is I have an oxygen graph that I show all the patients. It's just a graph that's laminated, and it goes from some online really low oxygen ones that are heavily advertised all the way to the high oxygen. Because particularly our competitors and online people want it to sound like all contacts are the same, and we know they're not, but patients don't necessarily know that they're not. So it's really easy to visualize. They can just look at it and see that the lenses that I'm recommending have more oxygen than maybe some of the ones they've heard about. The other thing I do is we have specular microscopes in the office, so we take a corneal map of for all our contact lens patients. And that also is a good way to show them if they do have corneal edema, why we want to get them out of those lenses, those old type lenses that are causing swelling, particularly since many people overwear the 2-week lenses. I think they wear them 5 or 6 weeks. So, and then on top of that, it helps with getting them back next year, because we're able to say, I have a number now that I can compare next year to see if these new lenses are decreasing the swelling, which I do expect that they will. So those two strategies of just showing the decays of different lenses and then showing the picture of their corneal endothelium seems to really help in that area.
Yeah, it seems like there's like the education piece, the visual education piece, but it's also, the auditory, right? I think of many people as, the visual learners or auditory learners, right? So I love that idea, right? Being able to showcase those oxygen maps is what you're saying. To show, what the levels of oxygen that they were getting versus, what they're doing now. And would you say overall, and I'll open this up to all of you, would you say that your patients have been pretty receptive to this approach from the standpoint of, actually talking about oxygen, right?
I think so. And what I do is when I have them in the slit lamp and I'm, doing my evaluation, even before I talk about contacts, I talk about what I see, and I ask them, do you feel like your eyes are redder at the end of the day? Everyone's working from home. So I feel like while that's great and they're not commuting, they're spending more time. I ask people in general, do you feel like you're spending more time on screens? And everyone looks at me and goes, oh my gosh, I'm not commuting. I'm not taking the train 4 hours a day, into New York City. I'm spending those extra 4 hours on the computer plus more. So as I'm doing, as I'm looking under the slit lamp, I'm talking about what I see and letting them know that there are better lenses available that will let more oxygen in to help with that and to help them feel better and see better. And I think, when their chin's in there, they're a captive audience, and, they know I'm seeing something. So I think, for the auditory and also the visual, I'm kind of describing what I see. So I think it's hard for somebody to say, I don't want that, I don't want that lens that's going to make my eyes less red. But, while they're a captive audience in there, I think it's really powerful to talk about.
Yeah, I don't think you can beat that, right? When you're right there and they're like, what is she actually looking at, right? So you're able to have that conversation with them.
It's very powerful.
Absolutely. Now, would you say, are there certain patients, and I'll open this up to the floor, right? So are there certain patients that you would say that you recommend 1-day silicone hydrogel lenses to versus others, or where's your take on that? And let's just go around the room on this one, because I think we all might have different, maybe slightly different opinions, but who wants to take this one?
Yeah, I'll take that one. So, it's not just the first time wearers or, people that we're trying to switch modalities. It's really everyone.
Yeah, I think in my career, when new modalities come out, ODs tend to use them as a problem solver because they're good. And then I think as time goes by, I think we all realize, well, why am I using it as a problem solver? Why don't I just not have the problem in the first place? So that's how I feel about these. I just, they are really all I do, and there's all different options now with the toric and multis and so forth. So I think that's kind of a natural progression we all go through. And I try to get there sooner than later. And I found these lenses are just wonderful for that. And I think, as we discussed earlier, this is an ideal time, if you haven't jumped in yet, with the public's really focus on their own health. This is a great time to bring up these new options.
I'd have to agree. I think there is not one patient I think that couldn't benefit. And I make it my personal goal that every patient I walk into the exam room every day, that if their prescription is available in a daily disposable in the silicone hydrogel, which fortunately most are, it's very rare. There's going to be patients that don't fall in that range, but with the great families we have, I make it my personal challenge to walk in there and figure out how I'm going to get that patient into the best lens available. And, I can't think of anyone that would not benefit, whether it's a first time wearer, somebody who's been wearing lenses for 40 years, multifocal, toric. I had a patient that for years has been wearing a 2-week lens, and, I've tried all my tricks, and, I think I every year I'm like, oh, I can do it this year. This is the year. And they, I've been unsuccessful at changing this person into a 1-day, which is very frustrating. But this year I walked in there and I said, you tell me what you do. When you go to the grocery store, do you come home and take a shower and kind of, change your clothes and clean everything? And she said, yes. And I said, what about your contact lenses? You're cleaning them, but you're putting the same pair back in tomorrow. And I said, what if I could give you the lens that is going to be breathable, comfortable, and every day you have a fresh lens? And she looked at me and said, that's amazing. I didn't think of that way. So, I think using every patient, there is no reason that we shouldn't be doing it.
Yeah, and you think about it from the standpoint of what can you provide for that patient, right? That's going to be able to really maximize their needs, right? And it sounds like from what you're saying, everyone can really benefit from these opportunities. And and sorry to put you on the spot, Dr. Jen, but what percentage of your patients would you say are 1-days at this point?
So we're pretty proud. Our practice is anywhere between 88 to 92% daily disposables. So there are a few percentage that, for whatever reason, either we have been unable to convert them or they, fall outside the range of parameters that are available. But we're really proud of how many patients of ours we have been able to successfully educate and fit into the best lenses that are available. And we continue to strive for 100%. I wish hopefully next year when we do this again, I'll have 100%, but we're really proud of that. And we think it shows in how we take care of our patients. And I wear a silicone hydrogel 1-day lens. So I couldn't imagine fitting a patient into a lens that I wouldn't fit myself into. And there's no reason for me not to fit them in those.
Yeah, no, and I think maybe, Dr. Drew or Dr. Jack, if you want to share maybe kind of like your percentages, but I know like in general, like when we think about it, right, yes, we're always trying to get that number. I know Dr. Jen's a very competitive person from the standpoint of she holds 2 school records at your university in track and field. So not a competitive person whatsoever. But when we think about it, right, we think about like, yes, always trying to improve, right, and always trying to improve that patient experience as well. So yeah, Dr. Drew, it sounded like you wouldn't mind showcasing kind of like your numbers and how you've seen that grow. And I think from that standpoint as well, your patients are kind of expecting that now with going to see you for so many years as well.
Right. Yeah, you definitely get that kind of positive snowball effect. And so we're probably about 65% on silicone hydrogel 1-days right now. And it's definitely increasing. I know what really solidified it for us, and we have 4 doctors in my practice, is, we had a conversation about, again, and I like what Dr. Jack said about the not being just a problem solver, right? And so it's starting to take those people that come in that, say, hey, I'm doing fine with my lenses, but they're in a different modality. And you know that even though they might feel like they're doing fine with their other modality, that there can be improvements. When you start, giving it to them and then they come back the next year and say, wow, I would never go back. I love the new lenses that you fit me in. That's when it really starts solidifying it for you. And that's, again, that positive reinforcement. So yeah, I'm hoping that we can get up to that 88 to 92%, but something to strive for, right?
Absolutely. And Dr. Jack, if you wouldn't mind sharing as well, because I mean, I imagine like we're all like, even if we start at certain levels, right, we're all looking to continue to improve, right? Because we understand what the benefit of a silicone hydrogel one day brings to your practice, to your patients.
Right. I don't know. I just feel like a track runner. Dr. Jen just lapped me. So
there you go.
So we're up to about 60%. We stopped doing 2-week lenses many years ago. So ours were in monthly and then the one day. So we had a lot of happy monthly wearers, and we still do. So it's a little bit more of a challenge, I think, for myself and the rest of my doctors to go from a month to a day. But it keeps going up, and with all the new modalities. So I track it every month, and it keeps going up, and I track it per doctor as far as that goes. So we're getting there. I don't know. Jen's out there, though. I don't know. I don't think I'm...
So when we look at it, though, right, when we look at, the importance of, SiHy one days to us, right, would you say, like, you've had to impart that maybe even on your staff as well, like the importance of having that educational opportunity with the staff as well? So, and from that, looking at this as well, like I know that, all three of you have had experience with CooperVision silicone hydrogel one days, right? So when I was in practice, the Clarity one day, that was definitely my go-to one day lens. And it was my go-to one day entry level, as it offered the silicone hydrogel at the price of a silicone hydrogel at the price of a hydrogel. And patient satisfaction was always high with that. And then I prescribed my day to the patients that I wanted to upgrade from that one day hydrogel contact lens. So, in your practices, like, just love to hear where this lies in your practice, but what are you seeing in your practices when it comes with where Clarity or where MyDay fits in your practice?
Yeah, in my practice, Steve, the Clarity is really a workhorse lens for us. It just has that great combination of oxygen permeability, comfort, and and the cost to the patient. So when we are upgrading patients from other modalities, it's really an easy lens for them to go into. And we're definitely doing a lot of MyDay as well. And so I think pretty soon it's going to be about 50-50 in our practice, but both have been very well received.
I'm in agreement. Clarity is my workhorse as well. I think it's a fantastic lens, great price point. We were a huge ProClear one day practice. I think, we had like almost everybody at one time was in ProClear one day. So for those patients, it's just a really easy upgrade. So for us, we had a lot of crossover from ProClear to Clarity. I love Clarity as somebody who is nearing presbyopia, that, I know with my patients, I can keep them in a lens for a long period of time. And I love Clarity because I tell them, if your prescription changes, I can keep you in this lens, whether you need a little help reading, whether, your prescription changes and we need to put you in a lens for astigmatism. I don't have to keep refitting you. All I have to do is change, the design of the lens, but I'm not changing the material. So that lens that you really like, that comfort and that clarity of vision, I'll just take that and change the lens design. So I find it really is a great way to keep patients in lenses. They're great for new wearers. I love MyDay too. It's hard. I think I'm going to get close to 50-50 also. It's sometimes a hard decision, but MyDay I use for, patients also coming out of one day hydrogel lenses, or some 2-week lens wearers. I find that that's an easier transition to them for, based on the way the lens feels. But, I think between the two of them, I really feel like most of my patients are covered.
Right. I'm doing more and more Clarity. Right now, the MyDay is my workhorse. I probably do about 80% MyDay. But I like the Clarity, as Jen said, you've got all the different family of lenses there. So, and I personally wear the Clarity. I know it's hard to believe, but I blew through into presbyopia a little while ago. So
a couple years ago, Jack.
A couple of years ago, yeah. I had an interesting thing happen to me early in my career, which was a blessing, really. this well-off attorney had come into my office, and at the time, you know, there was just conventional lenses. So he said, fit me with the best you got. And I did. And then about a month or two later, he brought his son in, and I fit his son into what we had as a starter lens for children. And my contact lens manager said the dad would like to talk to you, which a lot of times isn't such a great thing. But I did talk to him, and he said, why did you fit my son with this starter lens? And I said, well, that's what we normally do. It's less expensive. And he said, but I didn't ask you to fit him with a less expensive lens. You told me a month ago this was the best lens, so why didn't you fit my son with it? And obviously I've not forgotten that, and I tend to forget what I had for lunch. So that was a very impactful thing. So what I do now is, you know, my day's really good, as is clarity. So we're just using a lot of both those lenses, just depending on a lot of different factors. We tend to kind of go more clarity for the younger people. You know, it handles really well, and there's a lot of astigmatism in Texas and so forth. So they both work great, but yeah, we just started out doing a lot of the My Day, and we just kind of continued that.
Wonderful. And so, you know, with all of your experience with both Clarity and the My Day family of lenses, do you find that when it comes to silicone hydrogels, patients are more satisfied when it comes to silicone hydrogel 1-days? Would you say they're more satisfied with their lenses?
Absolutely. You know, I think we're seeing less patients who are dropping out of lenses. And, you know, I don't consider everyone, you know, I don't only consider patients who drop out those who stop wearing. You know, I pay careful attention to how many boxes they've ordered and when they ordered them. And if I notice that, you know, they went from annual supplies to 6-month to 3-month, and they're still coming in annually for their exams, that's a great time to step in and ask those questions about comfort. But I see that less with my silicone hydrogel patients because those lenses are so comfortable, and they're, you know, they have great vision with them. So I think, you know, for patient satisfaction, they're great. We get a ton of referrals from patients who are happy. There's so many patients still, it's amazing to me when I bring up a 1-day lens on a new patient, they like almost fall off their chair because they've never heard of it. And I'm going, oh my gosh, you know, they're just shocked that I've never heard of this fancy new, you know, type of lens. So, you know, they're so excited to have that option, and then they quickly, you know, share that with friends. Like, I have a lens I can throw out every day. So, you know, at the end of the day or after I go grocery shopping, you know, I throw that lens out. Isn't that amazing?
Yeah, no, it sounds like, Dr. Jen, that you're definitely being very proactive conversation.
Absolutely.
How about Dr. Drew? You know, do you find that your patients have been overall very satisfied with the silicone hydrogel 1-days?
Yeah, absolutely. They're very happy with the overall wearing experience. They love not having to deal with contact lens solutions and cases, and you know, just having one less thing to worry about. And I think what really strikes me about it is the people that we have in 1-day silicone hydrogels. How, again, like Dr. Jen said, how amazed they are at the level of comfort and you know, vision and less redness that they get when they're wearing them. And I can just think of a couple from this week so far, people that came in and said, I absolutely love these lenses. And I can't remember a lot of people that were in monthly lenses, you know, that came in and said, oh, I just love these, you know. When the patients are passionate about it, I think that's really good feedback.
It makes you feel good as well, right? Like, you're like, yes, taking care of that patient and being able to, you know, help them. And then not only it helps you, but it helps your practice as well. How about Dr. Jack, on your end, would you?
Yeah, one of the best things I ever heard at a conference was the speaker was talking about, like, what do patients say when you say, how you doing with your contacts? And you all say, fine, right? So he recommended we do this, and it was one of those things I started doing it. At first you wonder, he's a speaker, you know, no offense, Steve, right? But, but you wonder if it's gonna work, right? So next patient, when I get back to the office, I say, how you doing with your contacts? And he goes, fine. I go, how do they feel at 6 o'clock at night? And they go, oh yeah, they're off the minute I get home. I said, so do they get worse all day long? And they go, yes. Well, I'm glad you've noticed that, because there's a lens now that we won't have that issue. So of all the conferences, that was one of the biggest things ever, to say, how are they doing late afternoon, early evening? And it's shocking when you start asking that question. It's shocking how many people aren't fine.
Yeah, you know, Jackie, when I hear fine, I heard this one time as well. Fine to me means feelings I've not expressed.
There you go.
So when I hear fine, and it sounds like what you did is you just took, an extra 20 seconds and you really dug a little deeper, right? And as Dr. Jen was saying, being a little more proactive in that conversation, because I don't think I've ever heard of a contact lens patient wanting to say, I want to drop out of contact lenses, right? And they might be afraid that if they don't say anything but fine, right, or good, right, then you're going to maybe take them out of your contact lenses. And I don't think that's what we want to do, right? We understand the value of what contact lens patients bring to our practices, and especially, in this day and age of the silicone hydrogel one-day contacts. So, and I guess I'll ask this question. One of my last questions is, would you say that, patients that you have transitioned to one day, specifically silicone hydrogel one days, have you noticed that like they come back next year and be like, no, I want to go back to my monthly or my 2 weeks? Have any of you had that at all?
I get once in a while. I actually had this last week where, I had a patient who, his wife works on Broadway. She was let go. He was furloughed from his job. And he said, I love the contacts you put me in, but, we're really struggling right now. We're not sure what's going to happen. Can I go to a monthly lens? And, and it wasn't about comfort. It was about cost. But I sat down and had a real conversation about, taking that daily disposable and comparing it to the monthly with solutions and cases. And, and that conversation stopped. So it wasn't, the comfort that he was having an issue with, it was cost. But the great thing with Clarity is that lens is so affordable that I can walk in there and feel confident telling the patient, I understand cost is an issue, but you're in the healthiest lens and it's actually not that much more expensive than what you'd like to do. And, I don't want to downgrade you, for a couple dollars over the course of a year. So, I think part of it's being confident and walking in there and not letting the patient dictate the choices you make. It would be very easy for me to go, oh my gosh, sure, let me put you in a monthly, but and he walked out and he got a year's supply of Clarity. They just need to know the value of the lenses that you're putting them in. And a lot of times they don't want to go back, but they don't know they don't know what the benefit is. So if we're proactive in that conversation when we fit them in the lens, telling them the benefits and why we're doing it, I think you'll have less patients the next year wanting to go back because they don't want to, because they know why you fit them in that lens. So, I think being proactive again in that first step of fitting them, you'll have less patients who are trying to go back to what they were wearing.
No, that's a great point, Dr. Jen. Any other comments, Dr. Jack and Dr. Drew, as we start to wrap things up here?
Yeah, on that note, I've only had, a few patients that, really tried to convince me to get them, to put them back in a 2 week or a monthly. And, the one or two that I gave the option to do that, when they called the office back, they ordered the dailies. So I think what happens is they get so used to wearing the silicone hydrogel one day, and the comfort is so good and they have such a good experience, they kind of forget about the experience of that they've had previously. So all it takes is that reminder for a couple of weeks and they'll call back.
There we are. Well, no, thank you everyone here so much for taking part in this lovely roundtable discussion. Dr. Jack, Dr. Jen, Dr. Drew, right? This has really been just a great opportunity just to hear your thoughts. And don't forget, this is only the first of a 3-part series. And so we will be together next Tuesday night at the same time, 7:30 Eastern. And that will be webinar number 2, why quality matters more than ever. So we'll be able to come back into your family rooms or your living rooms or your offices in another week. And we'll be able to have just that much more of an engaging conversation as well. So thank you, everyone, and have a wonderful evening. And we look forward to seeing you again next week. Thank you.
Thank you.